A program at the University of Illinois College of Veterinary Medicine is on the move. The Shelter Medicine program has been working to improve the care of shelter animals and help reduce animal overpopulation for years. The program involves a pet mobile surgical unit and travels to numerous communities to help out shelters who don't have the resources to employ a veterinarian. We'll learn more about this effort coming up on this episode of the Paul Report, so stay with us.
The Paul Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paul Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paul Report. I am your host, Kelly Goodwin, and on today's episode of the Paul Report, we are joined by Dr. Bob Weedon from the University of Illinois College of Veterinary Medicine. He is here today to talk about a wonderful program that is happening at the University of Illinois and frankly at shelters all around the area. Thank you, Dr. Weedon, for joining us today.
Well, thank you, Kelly, for having me here. It's nice. I just recently retired, actually, in that position.
Congratulations.
Thank you. This will be a little bit of a walk down memory lane, so to speak.
That's right.
But,
and there's a lot of great information to talk about. We're talking about the Shelter Medicine program at the College of Veterinary Medicine, and you've been the spearhead of that for several years. Before we launch into that topic, I'd like to hear a little bit about you and your background in veterinary medicine.
Well, I graduated from veterinary school. I went to another Big Ten university, Purdue, and was married at the time, and my wife was transferred to Wilmington, North Carolina. So I went down there and spent 27 years and never really felt like Carolina was home. I was the senior partner in a private practice and had been teaching at the University of North Carolina, Wilmington, teaching undergraduate students. So the opportunity to come up here and have 4 seasons again was nice, but also to then teach veterinary students. And I actually came here in January of 2011 as the veterinarian at Champaign County Humane Society, where the students did their rotation through that shelter, and that was the shelter medicine rotation. It was a half-time appointment, so the students really only interacted with me on a half-time basis, and I recognized fairly quickly that we needed to expand the training they were getting, and so I went to the university and proposed some ideas to expand, and went out and got a grant from PetSmart Charities to fund our mobile sterilization unit. So then I had a half-time faculty appointment at the college, and I was still half-time at CCHS, so we were going on the road a couple of days a week, and at CCHS a couple of days a week. And the program continued to grow, and eventually then I went over full-time as a faculty member, and they made shelter medicine a service area, which means that's actually an area within the veterinary teaching hospital, and I was a service head, so that became a full-time position, and we were then on the road 5 days a week, and some weeks 6 days a week.
What exactly is the Shelter Medicine program at the U of I?
It is a program that we work with local shelters. We have a mobile sterilization unit that was funded by a grant from PetSmart Charities that is totally self-contained. We can pull into a shelter. If they have an electrical hookup, we can use that. If not, we have a generator on the mobile unit to power it. We could literally pull up in your driveway and start doing surgery. Totally self-contained, and we sterilize shelter animals so that when they're adopted, they won't accidentally reproduce and contribute to the pet overpopulation problem. So they're sterilized prior to adoption. And we also do sterilizations on pets of low-income members of the community in order to prevent more animals being relinquished to the shelter, or perhaps having that animal being relinquished to the shelter if she were to get pregnant or he were to have a medical problem that could have been prevented by sterilization.
That leads me into my nenext question, which you may have answered, but goals of the program is, I'm sure, to control pet population.
It is.
Up there.
It is. We have, before I retired, I was full-time, and we have a couple of part-time faculty members as well. And it's interesting because our focuses are a little bit different. Dr. Lucia Agapis, who is a part-time clinical instructor, is really interested in shelter protocols and animal welfare in shelters and making the lives of animals in shelters better and making shelters more efficient and preventing disease spread and that sort of thing. My focus has always been, and probably always will be, animal population control. In addition to what I'm doing here, I'm also on the board of directors of an organization known as the Alliance for Contraception in Cats and Dogs, which is an international nonprofit whose mission is to work to develop non-surgical methods to humanely control populations of dogs and cats around the world. So my focus has always been animal population control, and as a result of that, training veterinary students to be efficient in spay-neuter, whether they're working for a shelter or whether they're in private practice. Efficiency is something that translates to being able to sterilize more animals. If you have 30 animals, if you're a shelter vet and you have 30 animals to sterilize during the course of a day, and you're efficient and you can shave 10 minutes off of each surgery, do the math. You'll save 5 hours in just that one day. So our goal, we teach high quality, high volume spay-neuter techniques. And our goal is to have fourth-year veterinary students by the end of the 2-week rotation down to around 20 minutes on a cat spay. There's so much variation in dog spays, little dogs, big dogs, fat dogs, skinny dogs. But a cat's a cat's a cat. And so if they can spay a cat in 20 minutes, then they're going to be very efficient. I had a student several years ago that had just graduated, and she'd had the rotation right before she graduated, and she was a very quiet, shy individual, and she got down to 20 minutes by the end of the rotation, went on a job interview, and I have them keep a log of their surgeries, including the times, so we can track their progress. And she took her log sheet with her on the interview, and the guy asked her about her surgical experience, and she said, well, I've done 55 solo surgeries. And he was a little skeptical because at the time that was kind of atypical for a U of I grad. This was several years ago. And she pulled out a log sheet and said, no, Dr. Weedon had us keep a log sheet, and showed it, or gave it to him, and he looked at it. And here's the really cool part. Remember I said she was shy? She looked at him and said, would you like to see what I can do? I brought my scrubs. And the guy was, well, as a matter of fact, we've got a cat that needs to be spayed. She spayed the cat, took her 25 minutes. The guy offered her a job on the spot because his current associate, who'd been there for 2 years, routinely took 45 minutes to spay a cat. And so they could now do 2 an hour rather than 1, which would generate more income for the practice. Mm-hmm. So that's my focus, animal population control and student training. But the overall focus of the program, in addition to animal population control, is working with shelters to make the lives better for animals that are in these shelters and make things more efficient for the shelters so that they don't waste resources.
You mentioned this wonderful story about this student. Leads into my next question on exactly how the shelter medicine program is integrated into the curriculum and the learning environment at the college.
Well, most of the students who take the 4th-year rotation are there to get the surgical experience, the spay-neuter experience, because that spay-neuter is kind of a bread-and-butter surgery that is very common in most private veterinary practices. Although, interestingly enough, because most shelter animals now are sterilized prior to adoption, private practice veterinarians are doing less and less spay-neuter. However, if you can spay a dog or a cat, you can also do a cystotomy to remove bladder stones, or you could do a splenectomy, or you could do an intestinal foreign body, because you have the tissue handling skills to be able to do these other surgeries, because you've been developing muscle memory doing spays and neuters. We also offer 2 elective courses for students. First and second year students, we have an introductory shelter medicine elective course where we go over the guidelines. The Association of Shelter Veterinarians several years ago produced a document called Guidelines for Standards of Animal Care in Shelters. And we use that as a textbook and go through that. It's a really nice overview of shelter medicine. And then for third year students who've had bacteriology, virology, we offer an advanced shelter medicine elective course that spends more time focusing on infectious disease prevention and control and sterilization techniques and whatnot. So it's not a mandatory aspect of the program, but the fourth year rotation fills up mainly because the students want the spay-neuter experience.
Can you go into detail more on your outreach services and exactly how many shelters do you partner with in Central Illinois?
There are a dozen or so shelters. We try to stay within an hour of the university just because travel time, makes for a long day. We go as far north as Watseka, it's a little over an hour. We've gone to Kankakee, that's over an hour. But typically, we're in Coles County on at least a weekly basis, sometimes twice a week. They are probably our biggest shelter partner and the one that I think where we've made the most difference. But we go to Danville. We partner with 3 organizations in Vermilion County. We go to Bloomington, 2 organizations up there we work with. And we've been talking with the DeWitt County animal control people about going to Clinton, which would be on the western edge of our service area. So, we get around. We're on the road every day during the week.
Why do you believe you've made the most strides in Coles County?
Because they have really changed how they do things. And if you look at their numbers, they were one of the first shelter partners we started working with. And if you look at their numbers, Julie Dieters, their director, will show you that I think we started going there in 2013, maybe late 2012, early 2013. But every year since we started going, their cat intake numbers have dropped and their euthanasia numbers have dropped. Because not only are we doing shelter animals, mostly dogs for them, but we have started a community cat program where we do low-income cats or cats of low-income people in the community. But we also started a barn cat program. When we first started going there, if somebody brought a cat in a trap, it was assumed it was feral, unadoptable, so it was euthanized. But now the students will sterilize that cat, vaccinate it for rabies and FERCP, and then the cat will be placed in a barn home where it can live out its life being a mouser, and the farmer doesn't have to worry about the cat reproducing and having unwanted kittens. So it's an opportunity for these cats to live a normal life as opposed to just being summarily euthanized because they're unadoptable.
I want to hear more about this Vetmobile on wheels. What is it? Tell me about the inside. How is it staffed? We were joking about you pulling it into the parking lot here at the station.
Yeah.
So it's a...
We could literally pull into your parking lot and start doing surgery. It is totally self-contained. It was funded by a grant from PetSmart Charities back in 2013. It took a while to get through the university bureaucracy to get it ordered and built, but we put it in service in January of 2015. The first surgery done on the mobile unit, and you'll see it, we have a picture of it on the mobile unit, was my first intern. We have taken, now we're on our 5th intern veterinarian doing a shelter medicine internship. doing my first intern doing the inaugural spay on January 7th of 2015 here in Coles County at Coles County Animal Shelter. And there are 2 surgery tables in the aft part of the mobile unit. It's a 32-foot gooseneck trailer pulled by a pickup truck. There are 2 prep tables in the forward part, and each table has its own anesthesia machine. So while 2 students are doing surgery in the back, 2 more students can be getting the next animals ready. So we really strive for efficiency. As soon as one comes off the table, that table's disinfected and the next patient goes on and the student starts the surgery. So we schedule on a point system, but we'll do, on a typical day, we'll do 15 to 20 spays and neuters. And if we're doing an all-cat clinic, for instance, a feral cat clinic, we'll routinely do 30 sterilizations during the course of a day.
So I would say the success rate of helping to control the pet population with this program has been very successful.
If you look at the numbers, and we do, if you think of the mission statement of a land-grant university, it's teaching, research, and outreach. And our program encompasses all 3. We're training students. We have the opportunity to collect tons of data. I already mentioned to you that we've been collecting data on the owned animals that we sterilize, and 80% of them have never been to a veterinarian. So we're not competing with local veterinarians because these animals aren't going to local veterinarians. Mm-hmm. As a matter of fact, we're educating these clients that, hey, these animals need ongoing parasite prevention, internal and external, and periodic revaccination, and give them a list of local veterinarians to access those services through. And so, that's the research component and keeping track of numbers of animals we do and whatnot. And then outreach, of course, we've already mentioned that we're impacting the lives of pets in the communities that we serve.
Mm-hmm. Where would you like to see it go? You mentioned you're retired, and
Yeah.
again, congratulations.
Thank
but
you.
This program is not going away. It's going to continue to thrive and grow. You mentioned maybe the expansion of the unit going to other places. Other maybe research ideas or thoughts for this program?
Yeah, I've had a number of research ideas. I was involved in my position with the Alliance for Contraception in Cats and Dogs. We did a field trial 2 years ago of an immunocontraceptive vaccine, a vaccine that would contracept a female or male cat for a period of time, which would allow us to, if we had a colony of feral cats, we could trap them and just give them an injection rather than having to knock them down and anesthetize them and surgically sterilize them. So it would be a lot more efficient. And one of the things that we do now with our feral cat sterilization is everybody gets vaccinated for rabies. But interestingly enough, the label on the rabies vaccine says for use in animals 12 weeks and older. Oftentimes we'll get feral kittens that may not be 12 weeks based on their size. And those guys, if we can get them out of that colony and in a foster home and get them socialized, they may potentially become adoptable, but not in every case. So I had plans to do a project looking at antibody response to rabies vaccine in kittens under 12 weeks of age to see if vaccinating these animals, even though we can't give them a certificate, does afford them some protection. So that's a research interest of mine. And there's so many other things. We just got a grant from a local trust out of Springfield, the Sally Vaughn Trust, to establish a community medicine program with the goal being to provide preventative health care services to underserved animals in communities with the overarching goal of keeping them from being relinquished to shelters in the first place. Mm. And the story I tell is there was a shelter up in Kankakee. These people showed up with a box full of puppies that were all sick. Turned out they had canine parvovirus. The shelter was not equipped to treat parvo, so they sent them down to the U of I emergency service. And so those 7 puppies were treated at a cost of $28,000. Most shelters don't have those kind of resources. So we could have intervened in a number of points there. Once we get community medicine up and running, if we had vaccinated those puppies, they may not have caught parvovirus. If we had vaccinated the mother, she may have had immunity to transfer temporary immunity to the puppies, so they may have not caught parvovirus. If we had spayed the mother, she never would have had the puppies in the first place. So there are a number of points where we could have intervened to prevent that from happening. Now, the students that are coming out of this program hopefully will have the tools to work with shelters in their communities to say, you know what, there's a growing body of evidence that you can effectively treat canine parvovirus on an outpatient basis. They don't require intensive hospitalization, which is very expensive. So you set up a foster network, people to care for these animals, and give them subcutaneous fluids so they don't get dehydrated, antibiotics because their immune system is suppressed by the canine parvovirus, and anti-vomiting medication to get them to stop vomiting. The results of these outpatient treatment protocols are just as effective as the inpatient treatment. So our students will have those tools to be able to work with shelters to prevent them from having to expend resources that they don't have.
I'd like for you to share with us another story as we wrap up our discussion today. Something most memorable for you. Maybe it was a pet or maybe it was a teaching moment with the countless vet students that you've worked with over the years.
Gosh, there's so many. The teaching ones are the students who get it. Like the student who got a job because she was an efficient surgeon. I think to me the most compelling story is here in Coles County, because of lack of resources, if a dog tested positive for heartworms, it was euthanized because the shelter felt that they didn't want to saddle an adopter with a tremendous expense. It could be $2,000 to treat heartworms. A study was published recently in a journal that showed that there's another effective way to treat heartworms without using the expensive medication to actually kill the adult heartworms. It is actually a preventative that's given topically. It has a product in it called moxidectin that is a preventative, but that builds up in the body so that if an animal has heartworms, it will actually cause them to die over a period of time. And we call it the moxidoxy protocol because using moxidectin and an antibiotic, doxycycline. And this study was really nice because you put on 30 days of doxycycline, topical monthly moxidectin, and within a month, all dogs were free of microfilaria, the baby heartworms in the blood, and by 10 months, all dogs were free of adult heartworms. And so you don't have to restrict the activity because you're not giving a shot that kills 85% of the heartworms in a short period of time, so the dog can't go out and run because those worms could embolize and cause a pulmonary embolus. And you don't have the expense of using this product, melarsamine, the injectable for the adults. So shelters are now, if they have a heartworm positive dog, using this protocol. So it saved the lives of countless dogs here in Coles County and with our other shelter partners. So, and one of our students adopted a dog and that was heartworm positive, and that dog is now free of heartworms.
Wonderful story. What a great way to end a discussion today on the shelter program at the University of Illinois. Dr. Weedon, recently retired. Thank you so much for joining us today, and I look forward to hearing more about the program and research and outreach in years to come. Good.
Thank you for having me, and I'll be around, so if you have any other questions, let me know.
Excellent. And if you have questions out there, you're more than welcome to call the University of Illinois Veterinary Teaching College or the Teaching Hospital up at the U of I. They're always gracious and very nice about talking to any of you out there that may have questions. In the meantime, that's it for this edition of the Paw Report. We'll be back after this with a Paw Report Extra. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too. All pets need to be taken care of, but what happens when the owner becomes homeless and money is tight? There's a volunteer effort, a pop-up clinic, to lend a helping hand for animals in those situations. Joel Hillen reports.
Getting off trouble before it happens if we can. And if they already have a problem, we're going to treat it as well as we can.
Dr. John Geller is director of the Street Dog Coalition, a Fort Collins-based nonprofit that helps provide care for pets of the homeless.
People living on the street and near homeless folks have very little opportunity to get veterinary care, if any at all.
You see our kneecap just kind of slides back and forth.
In addition to an examination, each pet is given a rabies vaccine and a voucher for the pet to be spayed or neutered.
Pets need care no matter who their owners are and what the resources are.
Mike Topper is president of the American Veterinary Association. He and over 5,000 other veterinarians and technicians are in Denver for a convention. They saw this as the perfect opportunity to not only highlight the work of Dr. Geller, but join in the volunteer effort and perhaps create similar programs in their cities.
He's a good boy.
Helping people like Octavia Montoya. She purchased Cash just 3 weeks ago. She knew he needed to see a veterinarian.
It was really pulling on me, like, what do I do? What did I get myself into? And this was a blessing to see this. I saw it a couple of days ago on Facebook. So it's perfect timing.
Octavia was chronically homeless in her 20s, and things were finally getting better when she says she was recently hit with a roadblock.
I'm going through some tough stuff in my life right now, and having him to take care of, it gives me a reason to not just go off the deep end.
Cash gives her new hope and comfort.
I just hope that, not only having him would help me, but I want to help him, feel safe.
Safe and healthy.
Dave's Decorating Center is a proud supporter of the Power Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com. Additional support for the Paw Report on WEIU is brought to you by viewers like you. Thank you.